Hello friends, we are homeworkaustralia.com. We do Homework Australia assignment. Antibiotic resistance assignment help. Widespread and often inappropriate use of antibiotics has led to increasing numbers of organisms with multiple drug resistance. Antibiotics are not required for minor infections. Although the majority of antibiotics are relatively safe drugs, important toxic effects do occur when used in the incorrect dosage and in the presence of other disease states, notably renal disease. In addition, antibacterial therapy may result in secondary yeast or fungal infection or may facilitate the growth of a second bacterial pathogen, such as Clostridium difficile, an important cause of antibiotic-associated colitis. Choice of drug. Blind therapy. Antimicrobial therapy is often begun before the organism is identified and its antibiotic sensitivity is known. The choice of drugs is therefore dependent on a clinical diagnosis and a knowledge of the organisms likely to be involved in a given situation. Before beginning blind therapy, it is essential to obtain appropriate body fluids or other specimens for microbiological examination. Adjustments to the antibiotic regimen can then be made, if necessary, when antibiotic sensitivities are available. Spectrum of activity. The spectrum of antibacterial activity of the drug chosen should ideally be as narrow as possible, as it will then have fewer detrimental effects on the normal bacterial flora of the host. Blind therapy, however, by necessity generally covers a broader spectrum than required. Bactericidal versus bacteriostatic. In the majority of infections there is no firm evidence that bactericidal drugs, penicillins, cephalosporins, aminoglycosides, are more effective than bacteriostatic drugs, but it is generally considered important to use the former in the treatment of bacterial endocarditis and in patients in whom host defense mechanisms are compromised. Patient factors. In addition to age and pregnancy, the following factors should be considered. 1. The site of infection. The chosen drug must be able to gain access to the part of the body involved. The brain, eye, biliary tract, prostate and loculated abscesses are inaccessible to many drugs. 2. Renal and hepatic function. Impaired renal or hepatic function necessitates a major modification of the dose regimen or even complete avoidance of certain drugs. Care should be taken when using aminoglycosides, ticagrelin, fluticasone and some antimicrobacterial agents in patients with renal impairment. Other drugs, such as nalidixic acid and tetracycline, should be avoided altogether. Thanks for watching this video. Subscribe, like and share our videos.